Good evening, everyone. I think we'll get started and I welcome you all. We have a good crowd this evening. This is our third webinar of the 2021 Road to Independence Resource Fair, sponsored jointly by the Montgomery County Transition Work Group and the Jewish Federation of Greater Washington. Tonight, our topic is housing. Next Wednesday, May 19th, we'll be talking about living independently without government benefits, and we'll conclude our webinar series on May 26th with new ways of having fun. The link to register for the remaining events will be in the chat. Tonight, I'm hosting this webinar from Rockville, Maryland, and I would like to acknowledge that the original inhabitants of this land in Montgomery County were the Nacotchtank and the Anacostans. I would also like to thank our digital manager this evening, Sarah Robeson with College Living Experience. And our presenter tonight is Rosemary DiPietro in the Montgomery County Department of Health and Human Services. Rosemary is a native Washingtonian and started her professional career in public service, initially supporting teens at the Regional Institute for Children and Adolescents in Rockville. She later became a volunteer coordinator for the Therapeutic Recreation Department, and she has been with the Community Support Network Unit of Montgomery County since 2007, where she now manages the county's Coordination of Community Services, or CCS program. Rosemary has many years of experience navigating systems and supporting people to live their fullest lives, including finding a home they enjoy. In her free time, Rosemary enjoys adventures with her family, hiking, skiing, swimming, snorkeling, gardening, and advocacy related to equality for everyone. Guests Adam and Laura Russell are going through the process of preparing Adam to move out of his family home. Adam is 31 years old and also a native Washingtonian. Laura came to the area from the Midwest many moons ago. Adam and Laura will be sharing their experiences with you in just a little bit. Please do add your own questions to the chat as we go along at any time. Sometimes Rosemary will be able to answer right away, or we'll wait till the end of her presentation. And any personal questions she can answer by email. We're going to ask you to complete a short survey after the program. The link will be in the chat. You'll also get an email in the next day or two, and we'll also be sending a link to the recording of this webinar. You can access closed captions at the bottom. It just says live transcript, and you can get those. We're thankful for that from the Maryland Relay organization. So with that, I would like to introduce Rosemary and take it away.
Hi there, everybody. Can you hear me?
Yes.
Wonderful. Thank you so much for having me this evening. I am excited to see and hear that so many people are eager to learn more about how to live independently out in our community in Montgomery County. I am going to do my best to speak slowly because I know there are going to be a number of acronyms and definitions and content that might not be very familiar to some in our focus group here tonight. So please be patient with me. All of the resources that I will discuss throughout the presentation are provided either within the presentation module itself, which you will have a copy of, or as separate handouts, which will be provided following the presentation by the method that Karen, I believe, mentioned. Next slide, please. As I said, throughout the presentation, I will use terms and acronyms that may not be familiar to you. So if I forget to define something as I'm speaking, please do not hesitate to jot the question in the chat box, as Karen mentioned, and she will prompt me to clarify before I move on. So without further ado, I hope this evening that each of you will leave this presentation having felt a little more comfortable about the housing resources that are available in Montgomery County, specifically for people within our focus group here tonight. I'm also hoping that you'll feel a little more confident about developing a plan for living independently once we're through with our presentation tonight. Next slide, please. So what are my options? What are your options in terms of gaining independence for living out on your own? This slide shows a number of potential options for securing that place on your own. The first bullet point that I'd like to bring to your attention is the Housing Opportunities Commission, otherwise known as HOC. The Housing Opportunity Commission's mission is to provide affordable housing and supportive services that enhance the lives of low and moderate income families and people throughout Montgomery County. There are two HOC voucher programs that most people within our focused group can apply for. The Housing Choice Voucher Program, formerly known as Section 8, provides assistance for affordable, decent, safe, and sanitary housing in the private market. To apply for a housing voucher, a housing choice voucher, excuse me, a person completes an application through HOC and to be placed on what they've titled their housing path wait list. The Community Choice Homes provides affordable rental homes in Montgomery County for people with disabilities who have extremely low income. The CCH is the result of a partnership between HOC and the Maryland Department of Disabilities. A case manager, which might be a coordinator of community services or other social service case manager, refers clients to this program by completing an electronic application through a dedicated website called Social Serve. People should work with their case manager to ensure that their needs and desires are accurately reflected in that application. And what I mean by that is that when you come to a place where you decide you want to apply for a Community Choice Homes voucher, you will work with your coordinator or your case manager to ensure that that application has all of the things that you want and need in order to live independently in the community. For example, if you have needs that might require somebody to sleep over at your home with you, you would need a 2-bedroom apartment. And your coordinator or your case manager will need to know that information when they complete the application through the Social Serve website. Once the application is submitted, a person is then placed on a waiting list, and their case manager is the point of contact. Case managers are notified when a potential living unit is available, and that case manager is then responsible for notifying the person of the housing opportunity. To this point, I will introduce the idea that keeping track of your activities in preparation for the big day is essential to reducing feeling overwhelmed, confused, or lost throughout the process of moving out. Simply establishing a dedicated housing notebook will provide a more positive experience on this journey that you are undertaking. The next program that I'm going to mention is the Rockville Housing Enterprises entity. And that is operated under the same criteria as HOC's Housing Choice Voucher Program. with the requirement that the rental property be located within the Rockville city limits. The Section 811 project is a rental assistance program that makes a home in the community affordable for people with disabilities who have low income. This is a project-based rental assistance program. You will have rent payment assistance while you live in a participating housing unit. Some clarity of terms here. Project-based vouchers are assigned to a specific building, and recipients must reside in the building to receive the assistance. Recipients with tenant-based vouchers can use their assistance at any home, apartment, or other private market residence that meets household requirements, safety standards, and the rent is reasonable. When accepted into the Section 811 program, support includes linking the affordable housing with your services and supports, while also providing you the independence of living on your own. You sign the lease and have access to the supports that you choose. As with HOC rental programs, Section 811 Project Rental Assistance Program requires that tenants pay 30% of their income for rent and utilities. And this particular program pays the rest of the rent directly to the landlord. So a person, typically for any HOC type programs, pays 30% of the asking rent price within the means of HOC's allowable rent fees. The next program that I'd like to introduce you to is called the Harry and Jeanette Weinberg Foundation. This foundation has created an affordable rental housing opportunities initiative solely for persons with disabilities by partnering with the state of Maryland to create and provide affordable rental housing options. Designed to build upon the strengths of the foundation and the state's low-income housing tax credit program, this initiative seeks to increase accessibility, affordability, and independent housing opportunities in the community. To dive a little deeper, the state of Maryland receives 3 grants to administer project-based affordable housing for people with developmental disabilities. This program continues to grow, so it's important to have this opportunity on your radar. A person's case manager, again, applies on behalf of a person through the social serve network. The program on the left side of this slide can easily be applied to by registering on 2 different websites. One is the HOC Housing Path, and the other is the Social Serve website. There is no harm in applying for any one of the programs listed here years in advance of being ready to move out. But both of these applications will require ongoing monitoring and/or updating. For example, HOC typically requires annual update to their application, and Social Serve would need to be updated if a case manager changes, since they are the point of contact for those opportunities. Okay, on to another potential option for housing. Though they're moving away from delivering services in congregate settings, through nonprofit licensed organizations, the Developmental Disability Administration, or DDA, as most of us refer to that administration by, delivers residential services to people who have substantiated, assessed needs for a pretty high level of support, and they have no other living arrangement that can meet their needs. As many of you probably already know, there is an initial eligibility application process to go through with DDA. And eligibility does not guarantee any specific service. For some members of our focus group, the DDA offers opportunity for their independent living. And that support comes in many different forms. If a person has determined readiness to fly the coop and has found a living unit to move into on their own out in the private market, whether it is with somebody that the person knows or whether they're going to go it alone, but they need some support to ensure that they're healthy and safe. If eligible for DDA services, they may receive support in their living unit for a period of time during the day, evening, and/or at nighttime. So a potentially very useful resource has been added as a DDA waiver service, and that is called Housing Supports. It is primarily a service that will provide information and assistance to obtain independent housing. There are a few providers that are licensed to deliver that particular service at this time. And our guests tonight have a little experience with the tenants of that housing support service through their participation in a pilot program. More on that in a bit. I'm going to talk a little bit more about how our state and county are supporting creative housing options in a moment. But first, let's talk a little bit more or a little bit about the various different ways that people pay for this monumental life event, living on your own. I'm going to pause there for a minute because I just said a lot of stuff. And I want to give Karen an opportunity to throw out any questions that may have come through the chat.
We do have some questions, Rosemary, related to things you've been talking about. So first of all, what does CCA stand for? Do you use CCA or were you just talking about CCS? I'm not sure whether.
I didn't use CCA. I did say, I did pull the acronym for one of the housing voucher programs, which was CCH.
CCH.
And yeah, that is the Community Choice Housing, Community Choice Homes.
Okay.
Is another one of the avenues whereby Maryland Department of Disabilities and HOC have partnered to try to bring more housing options to this particular focus group.
If someone does not have a case manager, can the person apply directly for CCH? This particular person receives SSI, so is low income with multiple disabilities.
That's a very good question. And I knew I was going to be asked that question because as I was putting this presentation together, it further came to my mind to question why it is that a case manager is the point of contact and is the only one to do applications for this program and the Weinberg Foundation program. So in our handouts, I have listed, and actually we could go to the next slide, I think, to try to answer a little bit more about this question. So here I've placed some of the websites that are critical to as foundational information related to getting on some of these these waiting lists. And so the one that's related to social serve in particular is housinginfo.mdod@maryland.gov. And then there I've put a phone number there as well. So I would refer anybody who does not have some sort of case manager that would be familiar with social serve to contact the Maryland Department of Disabilities to find out how you might be able to get onto that waiting list.
You mentioned case manager. Would the case manager be the case coordinator with the community service, or like Mars or Total Care, or one of those, or BDHHS?
Yes, indeed.
Another person has said you've described all these options. How realistic are they for our population? For the people who are listening, how long are the waiting lists?
Very good question. Number one, I would say they are absolutely 100% realistic for our focus group. Thinking of your particular circumstances, one or the other may be a better fit. Now, I did say that there is no harm in applying for any of these waiting lists now, because it may take 4 or 5 years for the person who's going to move out to, number one, be ready, and number two, waiting lists are long. And I'm going to talk a little bit more about a few other options that are out there that also have, they have support, but they also have waiting lists.
And we have 2 questions related to that. How long before you need to access housing should you apply? And when do you begin planning for an adult child with a disability to move out? An adult who needs many supports and no family, do you start when they're in middle school? Do you start in high school? Someone points out they've been on a waiting list for HOC for 3 years. So when should you get on that waiting list?
All very good questions. What I would relate this to is the transition process that takes place related to a person's education. And that process starts, I believe, at age 14. Right. Age 14 is pretty darn young, and it may not be feasible to get onto waiting lists that young, but the planning, the tools that I'm going to get to in a few moments are all things that can get started early on in a teen's life. Waiting lists, I can't answer how long they are, but as one of our attendees has pointed out, HOC, they've been on that waiting list or on HOC's waiting lists for 3 years. And so again, it points to how important it is to keep track of what you've done and refresh those applications as required by each of the programs that we've discussed thus far.
Now, one of the agencies you talked about is Rockville Housing Enterprises. That wait list has been closed for a long time. If you know you want to live in Rockville, should you apply, get on that wait list for HOC? And then port your voucher, which is a whole nother issue and possibility.
Right. I would say there is absolutely no harm. in doing that.
Do
Okay.
apartments, you want to get on, keep on going? We can come back to some more
Go ahead and
questions.
ask me one more question, and then I think we should move along.
Okay, people are asking about the case managers. How do you get a case manager? That's usually comes when you're a transitioning youth, or you're working with DDA and you're receiving benefits and services from the Developmental Disabilities Administration, correct? I mean,
That is correct. And
asking,
and knowing,
I was gonna say, along with that, someone's asking if a doors case manager would be able to handle housing. I'm not sure about that. I don't think so, but I'm not sure. Go ahead.
so knowing that there are some people in our focus group this evening who may not yet have applied to the Developmental Disability Administration, or indeed have been determined not eligible for Developmental Disability Administration services. And in those cases, there are some other resources in our community where there is case management and support offered. And I think I'll touch on those momentarily.
Okay,
Can we go to the next slide?
Yep, go ahead to your next, continue.
So getting back to kind of the same, in the same vein of how am I going to pay for myself to live out on my own? How will I make it happen? And so we've discussed some of the options, but there are things that families can do well in advance, such as creating an ABLE account. This is a financial savings opportunity that the federal government set up, and every state or many states, I should say, administer, which provides the opportunity for opening doors to supplementing housing cost needs. An ABLE account is a way to save for eligible disability-related expenses, including housing and living expenses, as well as a host of many other daily type expenses. An ABLE account costs $25 to open. That's what you need to open an account. And that can, once opened, an ABLE account can essentially be used like a bank account in terms of supporting a person to pay for daily expenses. If you're receiving supplemental security income, or SSI, you can have up to $100,000 in an ABLE account without that money counting towards your $2,000 asset limit. I've supplied the website for the Maryland ABLE account program in our on our resource handout sheet. And I encourage everybody who has a disability that is defined by, in federal language, to open an ABLE account, so that there is never any question about having too much money in your bank account, and as a means to allow maybe family members to help contribute towards housing costs in a person's future. Another tool that should be considered when thinking about moving out for some people is what's called a special needs trust. And that's a savings tool which provides benefits through a trust that can protect a person from becoming ineligible for public assistance in a similar fashion to the Maryland ABLE accounts. However, the funds in a special needs trust are not permitted to be used for expenses related to shelter, and therefore a special needs trust can help shelter money that a person may receive, but it does not give the opportunity to save money for housing. It's just another mechanism that may be a useful tool for people when they're preparing to set money aside for adult living. On the right side of the screen, in terms of ways that housing can be paid for, are what I've listed here as waiver services. And these are services that would fall under the Developmental Disability Administration's authority, and for which many people in our focus group will be eligible for and begin receiving services under DDA waiver services at some time in the future. Waiver services can make living independently less financially burdensome indeed, but there are limitations to what waiver services in terms of housing can do for a person. HOC provides a host of supported services for renting and for owning property. And so in terms of having financial means and supports, not only does HOC offer housing at a markedly reduced rate for people who are eligible, but they also have many other resources that are available, such as classes and financial advice on accessing housing. Another program that can be used as a means to get into an independent housing scenario is the Montgomery County Moderately Priced Dwelling Unit Program, which offers affordable rents at a number of MPDU apartment complexes located throughout the county. People who are interested in the MPDU rental program apply directly to the apartment complex of their choice that is within the MPDU program. The management companies at these complexes will provide an application, verify income and credit history, and determine a person's eligibility or ineligibility to rent an MPDU apartment. There are minimum income standards which are set by each of the complexes that offer housing units for the MPDU program. And then the Moderately Priced Dwelling Unit Homeownership Program is yet another county program worth looking into for some of the people here in our focus group. This program offers affordably priced townhomes and condominiums, both new and resale, to first-time home buyers who have a moderate household income. And so this is a program that would suit needs for a person who may have gotten themselves a full-time job and they actually have an income that is at least $40,000 a year. There is a control period for owning an MPDU housing unit. And that essentially means that if you sell the home before the control period ends, you are limited in the amount of money that you can walk away from the home with. My understanding is that the county has set the control period to 30 years at the present time. So if a person purchases an MPDU townhome or condominium, they're purchasing it at below market rates, and they're tied to that home or condominium for the duration of the control period if they want to sell the unit at market value. All of the information and the details, more details about these programs is listed in the resource list that Karen will be sharing with each of you at the end of the program. Next slide. I put this slide into the program because I want people to be sure to kind of get a visual of one of the application waiting list programs that you yourself can complete. And in this in the HOC Housing Path waiting list application, you have the opportunity to indicate and get onto waiting lists for multiple different programs that HOC offers. Next slide. Here again is a number of the Housing Opportunity Commission's programs kind of written out for you to see the various options that HOC offers. And so well, maybe I shouldn't pause. Karen, are there lots of questions from?
There are quite a few questions, and we've actually only got about 20 minutes left. So
right.
So
I'm going to keep moving. I'm going to keep moving along.
I know you have your guests to bring in as well. So, and if to alleviate everyone's concern, we'll take the questions. I'm keeping track of the questions, and we'll answer them afterward and send the answers to you if we aren't able to answer them tonight.
Great.
Go ahead.
Next slide, please. So here are some examples of the creative and innovative programs that are happening in Montgomery County. As with other resources, I've included brief explanations of each of these programs and contact information in the resource handout. But to give you a brief summary of each of these programs, I'm going to start with the Maryland Inclusive Housing Corporation. The mission of this program is to help people with intellectual and developmental disabilities successfully access and maintain inclusive, affordable, and accessible housing of their choice by creating opportunities, identifying resources, connecting people, and providing services. MIH, their goal is to serve as a catalyst for the development and identification of affordable and accessible housing and housing support resources for people with intellectual and developmental disabilities and their families, in which the housing control is separate from services. When this program gets fully underway, people who have DDA waiver services will have the opportunity to access MIH services through that housing support waiver service that I mentioned earlier. MIH is a newly created entity that is led by the amazing work of Tim Weens, who has been in our field for his whole professional career, I think. And I'm very excited to see how people are able to access the support to be able to navigate how and where and when they can get into their own independent living situation. The next creative program that I want to mention and give a shout out to is the Madison House Foundation, which is working on developing housing opportunities on a tract of land out in farm country in Montgomery County. There's already programming going on with Madison House, but they are looking to expand by offering housing. Maybe some of you have heard of the program that's right in downtown Rockville called Main Street, which is a housing complex, an apartment building that was established to create dynamic opportunities through affordable, inclusive housing and community engagement, so that people of all abilities can live their best lives within one community. Inwood House is another housing option for people that may in this focus group, and that program runs and operates through a contract with the United States Housing and Urban Development Program. There is a multi-year waiting list at Inwood House, and that is a private. That would be a private a private process in terms of applying for getting on a waiting list at Inwood House. Another creative tool that has been implemented in Montgomery County is what's called Rosemary Communities Incorporated. And that is an affiliated corporation of the Archdiocese of Washington. And what Rosaria does essentially is identify properties and partner with the Catholic community to build and support housing for anyone in our community to take advantage of. Yet another is the Revitz House, and that is a one-of-a-kind affordable living option in Rockville. Whoops. So these are just some of the examples, and you know, there definitely are not limitless numbers of housing options out there, but there are some, and I very strongly encourage you to explore these various options that I've mentioned here. So in the next portion of the presentation,
I'm just going to ask you one question, because as one attendee points out, many of these organizations, Main Street and even Madison Street, we don't know whether they're continuing their building. Others have a very small number of apartments. Is there any indication, what is the potential for scaling up any of these programs? Because everybody is looking for something, you know, they need it next year, they need it now. What is the potential for now? or soon?
Right. So is HOC expanding the number of vouchers that they're issuing? I don't know the answer to that question. I do know that the Weinberg Foundation and the 811 projects are looking to expand in Montgomery County. Both of those programs operate throughout the state of Maryland. So when somebody gets on one of those through that social serve network, you can identify that you would be willing to live in other counties throughout the state. And there are units that are either being built or are in the pipeline through those two entities, and they are looking to expand more in Montgomery County. So I have chatted much longer than I rehearsed, and I want to get to I want to be able to for our program, you know, for us to be able to hear from our guests, Laura and Adam. And so at this time, I'm going to ask them to turn their cameras on, and we can go to the next slide. I'm going to be talking a little bit about tools. So as we prepare to hear from Laura and Adam, I want to again stress the importance of detailing and documenting your journey. This is one simple visual document that can help do that. Next slide, please. So I know it might be difficult to read. Welcome, Adam and Laura.
Hi. Say hello, Adam.
Hi, what did I say?
Just now.
I just
7.
saw something.
Okay.
Hello, everyone.
Hi there, Adam. How are you?
Good.
Thank you so much for being with us tonight. So Adam, I'm going to start with you. You're going through a tremendous plan to move out of your mom's house.
Yes.
And my question for you is, what are you looking forward to the most about moving out?
Having more freedom.
Having more freedom. Okay. And that has to do with being independent, doesn't it? Being out. Yeah. Anything else that you're looking forward to? Okay. When you have more freedom, what kinds of things will you do when you're living on your own?
For now, I'm just looking for a job, and then
okay,
that's part of my kind of freedom for now.
Okay, thanks for sharing that. So Laura and Adam took part in a moving out educational pilot program sponsored by the ARC Maryland and facilitated by the DDA provider agency SEEK. And the foundation of that pilot program was based on the charting the life course framework, which includes nationally recognized tools to help with planning. And some of their tools and a link to their website are included in the handouts. The Developmental Disability Administration has embedded many of their tools into its person-centered planning process. So Laura, in the few minutes that we have remaining, I would like to ask you to tell us about one or two of your biggest takeaways from this whole planning process that you are going through to help Adam get into a living situation of his own.
Well, like you said earlier, you know, you can get started right away, get started early. I remember when Adam was leaving Ivy Mount and things that we could have been doing at that time. Just get to know your child and document it. You know, don't just get through every day. Try and take notes. And because one of the things we did in the life course framework was to explain, you know, prepare documents that you can share with others. And ultimately getting housing is about what a parent wants to do is find the best fit they can for their individual child. And as you mentioned, there's lots of options for financing that and different models to use. So you want to have as much information as you can, both about what resources are available in terms of the things that you were describing earlier, what types of housing models there are, as well as who is your child? You know, what are their strengths? What are their weaknesses? What activities do they enjoy? What things make them happy? What things frustrate them? I view a lot of the documents that we came out of that life course framework program with as being kind of a guide that I can share with people who will be supporting Adam in housing initially when we move out, but also when we're not around. So to start a log and educate yourself on, you know, you want a couple of books, you know, you want one that's gonna note things that are unique about your child. Strengths, weaknesses, like what we have here is his one-page profile.
Yeah. And
Yeah.
if Sarah, if you could go to the next slide, I think I have some other kinds of examples while Laura continues to talk. We could go through a couple of others.
Right. Well, on this one, on the integrated star, then other things that you want to take notes on and research, and a lot of this is just about research, is what kinds of relationships and support networks do we already have? You should be thinking about building those kinds of networks. So Adam has been in Special Olympics since he was 9. That's a
So you
really
can go to the next slide.
community network. He does have DDA services. And at this time, a DDA supported environment is one that we are pursuing. But we've also probably 4 years ago put in an application to the HOC for housing. We looked into the moderately priced dwelling unit because that is an option. I think eventually we see Adam living in his own apartment with some supports, personal supports. But right now that we don't see that as the best first step for him out of our home to independent living. We feel like he probably would do better with a supported environment, a little more structure and more supports. So
wonderful.
For kind of a quasi-residential thing.
So Adam and Laura, thank you so much for sharing a little bit of your story so that the people in our focus group can hear a little bit from you. I'm going to wish you the best of luck as you're moving towards this amazing goal, and we'll move to the next slide. Thank you so much, Adam and Laura. Bye.
Bye.
Okay, so I know we flipped through the tools pretty quickly, and I have again attached those. I want to quickly reiterate again, next slide. There are going to be lots of questions that you have, and I want to say again, creating a folder that is specific to housing and independent living is going to be a really good friend to have under your arm. Next slide. Advocacy is a part of this building process that you will be going through, that you are going through. You're engaged in advocacy right now by taking part in these presentations. So I wanted to make sure that I name some of the various opportunities for advocacy before we closed out tonight. And next slide, please. Thank you all very much for giving me the opportunity to share some information with you, and for you taking the time to learn about how to best position yourself for this road towards independence. Karen, if you'd like to take a couple of minutes here to throw out the big high level questions, I'm happy to stay on. So go for it.
Okay, well, we have a long list of questions, a lot of them going, I mean, a lot of them just wanted an expansion of everything you said. So I think we'll send, as I've mentioned in the chat, we will send the resources to everyone. You'll get a copy of the updated PowerPoint as well as the resource list. That you'll get tomorrow, and also the recording for this webinar, so you can listen to it again. I have probably
that's wonderful.
Page and a half of questions, and we aren't going to expect Rosemary to answer them all tomorrow, but within a week, we'll get some written answers for those questions, as well as Rosemary's email address, so you do have a contact to answer questions. This is a challenging process. You all have been through challenges with your young adults ever since they were in school, and you've been an advocate, just as Rosemary was talking about advocacy. You've been an advocate ever since they've been small, and that doesn't stop. The difference is that now, in most cases, to some degree, even if it's a small degree, but to some degree, your young adult can participate in the process. Sometimes to a great degree, sometimes maybe by nodding and indicating what they like or don't like. Sometimes they can be much more fully independent than we anticipate and expect. Our webinar next week, May 19th, is Living Independently Without Government Benefits. And we'll have several individuals talking, including some self-advocates, talking about how they've been more independent. And I see someone in the chat says your son is 10. Well, now's when you begin to learn about all these things, and you create a checklist, and maybe there's a wait list now. By the time that son is 15, maybe there won't be. So preparing ourselves and educating ourselves is what we have, as parents, have done, as I say, ever since our children were born, and we learned that they had special needs that required all of us to be resilient and patient and creative. And I thank you very much, Rosemary, for all the information you presented. And we will look forward to continuing with everyone this evening. Please do click the link in the chat or here on the slide and complete our survey. And we'll get answers to your individual questions as soon as we can. Thank you very much.
Thank you so much. Thank you so much for having me, Karen.